Good morning, good evening, good afternoon. This is Dr. Garais, BIO117, and this is the lecture for chapter, let me see, where am I? I believe it's chapter 22, which is the reproductive system. Now, I failed to mention this in other classes, but I always see these. I really like a lot of these videos, especially made by this particular um, what do you call that? This particular channel, Crash Course. It does what I hopefully uh, my goal in any of my lectures is to try to make the complex simple. And there's really nice what do you call that? Diagrams and drawings and animation. So not only look at my lecture, I get a chance, look at this stuff. So let's go to, let's see. No, I don't have it there. So we will go into modules. And I believe we're still at unit 3 and yep, chapter 22. Let's look at give it a minute, because that is not what we want. Sorry about this. You guys can fast forward this part. Maybe the internet is not cooperating with us. Here you go. That's what we want. Okay. So let's look at the slideshow, play from the beginning. And of course, these are sperm. They have this little tails and this little acrosome head. And of course, this right here, this black stuff, that's your zona pellucida. That's what prevents more than one of these guys, in theory, to get in. And this is your ovum. So, of course, we already know about gonads. The male sex organ is, the male organ that produces sperm is called your testes, and the female organ is called your ovaries. And remember, your sperm and your ova is only half, right? You got to get, that's why you have to get one from your mom, one from your dad. So that 23 chromosomes is 1N, or haploid, and a set of a full human being is 2N, or 2 sets, and that's 46 chromosomes. So just like in the previous chapters, in Anatomy and Physiology 1, think sperm and ova are haploid. They only have 23 chromosomes each. That's why you need one set from mommy, one set from daddy, right? And then, of course, to make a complete human being, which is 2N diploid, 46 chromosomes, okay? We already know about meiosis. And if you don't recall, that was, we were heavily into mitosis first term. But now this new term, when we're talking about sperm and ova, we're now talking about meiosis, or the creation of haploid cells. So of course you have 2 sets of divisions. You have prophase, metaphase, anaphase, telophase 1, right? Which is just like, your mitosis, prophase, metaphase, anaphase, and telophase. But the difference between meiosis is they have 2 sets, because first I have to double up all the genetic information in the first prophase, metaphase, anaphase, and telophase. And then in the second prophase, metaphase, anaphase, and telophase, that's when I even divide it even more. So I end up with 4 gametes, or 4 cells. So in eggs or ova, you'll have 1 mature, and that's your Graafian follicle, right? 1 mature egg, and you have 3 others just in case. And then once ovulation comes, or that egg gets released, the other 3 degenerate and get recycled back in. And of course, with sperm, you have, with meiosis, it makes 4 sperm cells, 4 viable sperm cells. So this is what it looks like. You have the meiosis 1 to double up the genetic material so that you'll have 2 sets of 23 chromosomes, right? And then we double it up again. So at the very end, you have 4 gametes. So in the female, each one, of course, has 23 chromosomes, and each one will be an egg or an ova. And one ova will be dominant and one ova will be the primary follicle. And in male, all 4 of them will be sperm. And again, I have to reiterate, all gametes in meiosis, the product is 4 1N or 23 chromosomes. So in this one, 23 chromosomes, this one, 23 chromosomes, this one, 23 chromosomes, this one, 23 chromosomes. But we started with what? The cell with 46 chromosomes, just like mitosis. But in meiosis, they not only go through 1 set of cell division, it goes through 2, and it doesn't make 2 cells, it makes 4. Okay. And if you don't recall your mitosis, look at your old notes or Google it and go online. And I won't be on this particular exam or quiz, I won't be comparing it, but you make sure that you don't get the 2 confused. And of course, these are chromosomes. And the reason why we have to also have 2 divisions, I talked about before in classes before, genetic variation, right? In order for any species to live, plant, animal, or otherwise, there has to be a mix and match of genetic material. So you see here, you see how pieces of the genetic material get like swapped out so that not everyone is the same. Emotionally and psychologically, do you want to be all the same? No, no one wants to be the same. We're all individuals. But biologically, we have to be all the individuals in order for the human species and also any plant species to survive. Primary sex organs, of course, in the male is testes. Secondary sex organs will be like everything else, all your internal and external organs. So, for example, the primary sex organ in a male patient with an XY chromosome will be what? The testes. And then the secondary sexual organs are the ones that they developed during adolescence, during puberty, right? So you have your internal and external sex organs, and your penis, the scrotum, all the items we're going to be talking about momentarily. And of course, in the female, it would be the ovaries, and they produce, of course, ova or cell, right? But oh, look, this is, I think, what they want to do. We'll go through male first and then female. So, of course, male, testes. What do they make? Sperm, right? Spermatozoa are like premature sperm cells. And of course, they rely on majority of male sex hormones, particularly testosterone. Okay. Secondary sexual characteristics and secondary sexual organs, also known as accessory organs, will be developed in greater detail upon adolescence, upon puberty. Okay. So if we look at this, what's important, of course, it's called the genitourinary system. And we are, of course, in the pelvic area of my patient. We already know the GI. I already know my rectum, the sphincter here, external and internal anal sphincters, right? From our renal chapter, we already know that this right here is your urinary bladder. And then going through here, that's your urethra through the male penis. And then through here, of course, this is your prostate gland right here. And this is your bulbourethral gland. So you see, it's a little bit different. And you'll also see that the primary sexual organ is located like semi-externally here in the scrotal sac. And you have here your testes. But in female, of course, our female patient will have it up here. So here's the funny thing about not funny. Interesting thing. Here's the interesting thing about the development. All of us were the same. We all start off as the same sex, but depending on the message of our chromosomes, if you have XY, right, which is one of your chromosomes, it will dictate that you follow this pathway: development of penis, development of testes, and the descension of the testes, which start up here and then go down this tract right here. Now, what is this tract? You have here the vas deferens, also known as your ductus deferens. This is the thing that we cut if we want, if we don't want our patient, to release sperm. The sperm is made here, goes up and around here, mixes with the fluid from the bulbourethral gland and your prostate gland, and then, of course, out here through the urethra. Okay. Right above your testes, and of course the sac that houses it is called your scrotum, is your epididymis, and that leads into your vas deferens, up and around, and then it'll finally, it connects into your urethra, and then comes here through the junction and ends up here, of course, in your penis. And we're going to look a little bit closer at the penis as well. You also have other glands here. Here's your seminal vesicle. Helps also with the seminal fluid, because remember, the sperm, they're swimmers. They have to be in an aqueous environment to go swim. So you have all these glands helping you out so that they'll have the best environment when they go for their greatest race, assuming, both partners want to get pregnant. That's what the sperm is going to do. They're going to race, because the first one who gets in wins. That's all of us. So if you really think about it, everybody on this call, everybody on this earth, we were the best swimmers in our class, and that's how we came to be. So if you look here, it goes like this: testes, and then goes through your epididymis, up and around the vas deferens, right? And then into your urethra, passing your prostate gland here. And then it gets in through your penis. Now, if you look at your penis, it's not a muscle. It's you have the root here, and you have your body, and you have the glans penis, also known as the head of the penis as well. And you can see here, it's cavernous, and that's actually what it's called. And there's a lot of blood vessels in there, and that's what gives the patient the erection. Spermatocord, testosterone, and I already mentioned descent of the scrotum, but of course, you have to have the XY chromosome, which will signal the release of testosterone from your testes, and that's the initial, the descent of the scrotum in the last couple of months, and sometimes it doesn't happen. We got to help it along surgically, and that's called cryptorchidism. All you pathologists out there, and you can see here, it starts up here in the lower section of your abdominal cavity, goes through all the way down, and then of course settles here in your scrotum, which is the pouch that holds all of this. And you can see the gubernaculum is the actual, because remember, everything has to be tied down, but you could see that was the anchor, the gubernaculum, that was kind of helping the development and bringing that testes down. Now, what's the structures of the testes? What do they have in there? Maybe if you saw, they have these highly coiled tubes, right? And with specialized stratified epithelium. And that's what they're spermatogenic, means they make sperm cells. So that's what the seminiferous tubules of your testes are made out of. And of course, they're in lobules, they're in compartments, and we've seen compartmentalization before. And you have, of course, a tough fibrous tunica, jacket, albuginea, right? And something that's albino is what? White. So that's that white, tough fibrous capsule that encloses each testes and protects it. Now, you also have interstitial cells that's in between. And then, of course, think that's where the testosterone lies. So think interstitial cell, testosterone, seminiferous tubule, think sperm factory, okay? Reed testes transports the sperm from the testes to the epididymis, and the epididymis then transfers the sperm from the testicles or the testes to the vas deferens. Okay, here's another view. Your tunica albuginea, which is the outer covering. You have your seminiferous tubules, then connecting into your reed tubules or your reed testes that goes in here and then up into the epididymis, up through and then into your ductus deferens, also known as your vas deferens. And that's why that's the thing we cut if the male patient doesn't want to have babies, doesn't want to release sperm, and then hence the term is called a vasectomy. So accessory organs, and that's all the stuff that's extra, right? Epididymis, we already and the vas deferens, the ductus deferens. And of course, you have two, therefore, it's called ductus deferentia, which is the plural of it, okay? Now, your seminal vesicles. Now let's talk about all those glands that we just identified previously. Well, the seminal vesicles, I want you to think pH, because the as a protective function, the female vaginal canal is a little bit acidic because of course it's relatively open to the outside world. It's prone to urinary tract infection. We already talked about that before. So it develops a little bit of an acidic environment. Well, that acidic environment tends to kill sperm. So your seminal vesicles lets your sperm swim in an alkaline fluid to counteract that. And of course, it releases prostaglandins. And we may have mentioned prostaglandins when we were talking about immune function. And of course, it's going on in the outside world. We want to protect it a little bit. But the big thing is fructose, right? Because of course, we need sugar. We need some sort of fuel because remember, they're swimmers. They have this little flagella, they have this tail, and then it's going to do what? It's going to swim, and they're microscopic. They're at the cellular level. So swimming just a couple of centimeters, right? To the naked eye, doesn't seem like far, but to something that's microscopic, it's quite a journey, and it's a torturous journey because remember, the female vaginal canal is a little bit on the acidic side. Now, what does the prostate gland do for us? Well, the prostate gland also gives us an alkaline fluid. And another thing that it does is, since it adds to the volume of fluid, it actually enhances sperm motility, which is one of the things that we look at. We look at not only how many sperm cells you have, we also look at how well do they swim, and hence the word motility, okay? Now, let me see, I can barely read around. And of course, I already mentioned it increases the volume. So what could I ask you? What do the seminal vesicles do? Think pH, think fructose. What do the prostate gland does? Think what? Alkaline fluid, think sperm motility, think way more fluid volume. And to add a little bit help, right? You need that fluid, injected out, right? So anything that could help them swim. And of course, that's why the prostate gland also contains a decent amount of smooth visceral muscle. Bulbourethral glands, aka Cowper's glands, they have also think what? Mucus, right? Because something has to lubricate the tubing of the penis so that, again, you could see everything is geared towards the delivery, right? Delivery and protection. So if you have a question about bulbourethral glands, don't worry if I call it Cowper's, right? Just think what? Mucus. And we already know what mucus does for our GI tract. It's lubrication. So same thing in the genitourinary tract of our male patient. Mucus also means what? Lubrication. And of course, that lubrication is released in response to any sexual stimulation. And of course, the fluid. all of those fluids all put together is of course called semen. And also has sperm cells from the testes. It has all the secretions from the seminal vesicle, prostate gland. So the pH is a little bit, it's physiologic, but it's supposed to be a little bit on the alkaline side. And it's have, of course, prostaglandins, has nutrients, right? And don't need to know numbers, but remember, everything is geared for delivery, right? Scrotum and penis. Now, scrotum has smooth muscle in there, and it's called the dartus muscle. And actually, it has another muscle called the cremaster, if you believe that. It's true, not fooling around here, not being funny. So when you look at the dartus muscle, cremaster muscle, right? You know how when people say, like, hey, how you hanging, right? And of course, when they're talking about when it gets really, really cold, it contracts, the dartus muscle contracts and brings the testes up closer to your pelvis, which has a your core body temperature. And of course, if it's very, very warm, the dartus muscle will relax. And then because there has to be there is a optimal operating, what do you call that? Operating temperature. And that's why one of the first things we have in the questionnaire for infertility, especially for the male patient, do you wear tighty whities or do you wear boxers? And if they wear tighty whities, we start telling them what? Start wearing boxers, right? Because again, you want that area to be loose and not constricted as certain kinds of underwear would be, right? So we try that first. And who's responsible for protection, right, of your penis? Of course, it's the scrotum. It's the sac that holds it, and of course, it doesn't have a lot of subcutaneous tissue. Doesn't have a lot of fat. So who has to control its temperature? Dartus muscle. Penis, of course, is its delivery system, and it has erectile tissue, and the erectile tissue isn't bone, right? It is vascular tissue that fills up with blood, and like it's just like a hose. If you fill up with blood with very good blood pressure, what will happen? It will become erect. Of course, the glans penis, of course, is the most sensitive part, right? And prepuce, which is skin covering the glans penis. And that is the thing, or foreskin, that's the thing that get removed during circumcision. Now, the body or shaft contains 3 like tunnels that get filled up with blood. You have 2 corpora cavernosa, corpus meaning body, something that's cavernous is something like a cave. And you have, of course, the single corpus spongiosum, and that's the thing that wraps around your urethra. Let's see, so you have your corpus cavernosa, these 2 things, and your spongiosum here, and inside your spongiosum, that's your urethra. And again, here's the glans penis here, foreskin covering that, right? Also known as your prepuce, right? Pre means before, foreskin. You can see now you can see there's tons of arteries and veins, and there's also tons of nervous tissue. And remember, one of the most sensitive things is, of course, the glans penis, and of course your lips, because they have to be very sensitive. And of course, erection, right? Now, the erection itself and the sexual stimulation itself deals with the parasympathetic nervous system, because you can't be in a fight or flight mode, right? And it'll be too much blood pressure. So remember, we talked about Viagra, sildenafil, and all these other drugs were originally antihypertensive medication, all right? And then they promoted parasympathetic nervous system. Now, parasympathetic nervous system, the signal to decreased blood pressure and relaxation of your blood vessels is nitric oxide, right? Maybe remember we also talked about, that sublingual medication that people who have angina, they take, and that medication is, of course, nitroglycerin, because it's based on nitric oxide, which will dilate arteries. So of course it dilates the arteries, parasympathetic, right? Feed or breathe. Then they get in the mood, blood pressure gets dropped. So blood can easily flow. And then of course, there's swelling and an elongation. Now, whoops, let's bring it back. Now the thing is, there's a difference between erection and orgasm. Okay. At the culmination of the sexual stimulation, at the very, very end, it's now no longer the parasympathetic nervous system. It's now the sympathetic nervous system, right? So remember, the sympathetic nervous system is the exact opposite. So the best answer for erection, orgasm, and ejaculation is that it requires both. I want you to think parasympathetic nervous system for erection, orgasm and ejaculation. I want you to think sympathetic nervous system, okay? And of course, emission is the semen, right? The fluid that has to come first, because remember, I'm paving the way, not only lubrication wise, but pH wise, so that the sperm have a nice environment to go through. And of course, last but not least, ejaculation, right? It goes out of the urethra. Remember, we talked about the prostate gland also has smooth muscle, right? And these are now dependent on sympathetic nervous system, right? So of course, you start off what? Relaxed, but then you will end up what? But then, of course, the emission and ejaculation. So think erection requires parasympathetic nervous system, orgasm and ejaculation requires sympathetic nervous system. And know these terms as well. Here's a nice little diagram, right? Give it a minute for you guys to go through that, but it's the same thing what I actually said. Parasympathetic nervous system, nitric oxide. Then, of course, emission and ejaculation, that is now what? Sympathetic nervous system. Peristaltic contraction of all the testicular ducts, your epididymis, both vas deferentia, right? Rhythmic contractions and erectile columns of the penis, rhythmic contractions, and it's all what? Because sympathetic nervous system, but this is because this is now sympathetic nervous system controlling smooth muscle, okay? And in order for it to, go where it needs to go, it has to be forcefully expelled from the urethra, which is also another thing that we investigate if there is any infertility problems on the male side of the, of our patients. We already went through this. We already know it's meiosis. And of course, spermatids are your precursor cell. And what are they making? Sperm cells. All sperm cells have only 23 chromosomes. The head, that has enzymes in it. It's called the acrosome. So that once it hits the egg, that's what it's going to kind of like bore its way or drill its way through. And of course, you have the flagellum, you have that tail, and that's why it has to be in a fructose environment, because they need that energy. A lot of ATP is running through each one of those sperm cells. Okay, if you ever watched a video of this, they're what? They're all moving around. Hormones, hypothalamus, anterior pituitary, and the testes. And of course, they control all of these things, both not only primary, but secondary sexual characteristics as well. And remember, what's the primary characteristics is what? Your primary is testes, of course, dictated by your chromosomes, XY chromosome. And when you're in a further development during adolescence, during puberty, then your secondary sexual characteristics will start coming out, that the voice will drop. The male versus female, there will be a different fat deposition. There'll be increased muscle mass on the male. What else? And of course, sperm production and drive. We can't fail to mention the sexual drive. And when you think about it, all of it is geared towards what? Survival of the species. And then as you get older, what happens to that drive? Of course, hopefully it gets lessened. What are male sex hormones like testosterone and dihydrotestosterone DHT, which is a very illegal drug in sports medicine. So think androgens. Andro mean male, gen, creation of. Now, if you're a female and I start giving you testosterone, I start injecting DHT in you, what kind of secondary sexual characteristics will start developing? You'll start developing the same things as a teenage boy. So you're going to have jutting of the jaw. You're going to have drop in the voice. You're going to have increased muscle mass. You could see how that's desirable and entertaining to a professional athlete, right? Because they want, and also comes with it is what? The same sexual drive, and of course, with testosterone, there's linked aggression. These are the things we were talking about here regarding the secondary characteristics. Of course, it's the puberty. Another thing I failed to mention was there is a distinct pattern growth of body hair. And of course, more on, of course, your male patient with testosterone versus female, right? Now, testosterone is also linked with male pattern baldness as well. But you could see how all of this is very attractive to a professional athlete. Remember the statement that I made in several of my lectures. A professional athlete is not necessarily a healthy person, but they are what? They are a machine made to perform, right? So you could see why they would like these characteristics. Now, specialized functions. Let's now talk about the female side, which is a little bit more important because, of course, they're mommies, and mommies are the source of babies. So, like I stated, maybe it's different now in medical school, but 30 years ago when I was in 30, why did I say 30? 20 years ago when I was in medical school, I believe urology was a 6-week course, but obstetrics and gynecology were 2 separate classes, and they were 1 year each. I had OB-GYN 1 or obstetrics 1 and gynecology 1, obstetrics 2 and gynecology 2, and they were 2 whole years in 2nd and 3rd year. So you could see where the importance of the anatomy and physiology lies. So what is the female sex cell? That's, of course, egg cells or oocytes. And they only get released once a month. Of course, that's during ovulation at the midpoint, or some may say the peak of the cycle. But we'll show you the cycle momentarily. The primary organ, of course, is ovaries. They start and stay in the abdominal cavity. And then the accessory organs are all the stuff that gets developed later. Let's now look at the anatomy at this lovely mid-sagittal view. We already know the GI here. And of course, this is anus and your anal sphincter, and of course your rectum. You could also see here, you have your urinary bladder connected to your urethra, and this is your urethral orifice. Now, you will also notice that the outer anatomy have your labium minora or minus and your labium majora or majus, meaning 1. So you could see here, these are like doors to protect these tubes, but in actuality, these tubes are, they need a little bit more protection. Hence, if you look at the vaginal canal, right here, it's protected chemically through a slightly acidic pH. And you have here the uterus. And if you look, and it forms a little neck here, or little constricture, and that's called your cervix of your uterus, right? And the outer layer, of course, is your perimetrium. You have an inner or middle layer of muscle called your myometrium. And of course, we're going to be talking about your endometrium, which is full of tortuous blood vessels and a lot of tissue. And we're going to talk about that when we talk about the menstrual cycle. The ovaries and everything, they don't just float around in your pelvic cavity. I said abdominal cavity, but it's actually abdominal pelvic lower part. So that's actually pelvic in the lateral wall. So it's on the side. So they get attached, and they get attached to ligaments. So you have your broad, suspensory, and of course your ovarian. You can see here this picture. So here your ovaries, it's at the side of your pelvic of your, and then you could see the different ligaments that hold your fallopian tubes. And this is all exaggerated. It's not that big. Your uterus, of course, and this is a fallopian tube. And these are your fimbriae. And these little fimbriae, or these little fingers, they also have a purpose as well. We're going to talk about that momentarily. So that's your fallopian tubes, and they have these little extensions called fimbriae. And what the fimbriae do is they kind of create kind of like a current, because they kind of shove the egg down the fallopian tube through this current that they create, so that they will end up in your uterus, because that's the best place for implantation for an egg, because you want the egg to be in the uterus, because it's the endometrial lining, or the inner lining of your uterus, is quite full of blood vessels, which if the egg gets fertilized and becomes a fetus, it's going to need that. It's going to need all of that blood. Now, of course, you have mucosa with cilia, and you have middle muscular layers in your fallopian tubes, and they also do what? They utilize peristalsis to push the ovulated egg or released egg closer and closer to your endometrium, which is your uterus, the inner lining of your uterus. Okay, and where does fertilization occur? It should occur in these uterine tubes. It should occur in the fallopian tubes, but the final implantation has to reach the inside of the uterus, called your endometrium. Now, if it doesn't implant in the endometrium, and let's say, for example, that fertilized egg is elsewhere, then that's called an ectopic pregnancy. Ectopic pregnancies are non-viable, and they will do bad things to you if you let the pregnancy go. So it starts off here in the ovary. The fimbriae then coax that released egg, called the Graafian follicle, right? And then goes here. Now this is exaggerated. It looks nowhere this thick. In real life, it's like the size of like a pencil. It's very, very thin. And then it goes through here through peristaltic reaction, and then should end up here in the upper anterior section of the endometrium of your uterus right here. And this is called the body or corpus of your uterus. This is the fundus up here. That's where we get your fundic height when we're measuring to see how far along you and baby are. Of course, right down here, if I can find my mouse, cervix, and of course, here's the vaginal wall. When we take a, what's it called? When we take a pap smear, Papa Nicolo smear, I want to try to diagnose cervical cancer. So what do? We make scrapes here on the vaginal wall, here on the external os, and here on the internal os of your cervix. And that's why it looks like a little trident of brushes that brushes along here. And it's rather uncomfortable. Heck, why use the word uncomfortable? It's painful. You see here a lot of arteries and veins here. And then you could see, of course, your perimetrium, myometrium, endometrium. We talk body, cervix, endometrium, myometrium, perimetrium. Endometrium is the inner mucosal layer, right? Myometrium is the thick middle muscle layer. That's the thing that gives you your monthly cramping. That is the thing that will give you the pain when it's delivery time. And the perimetrium, of course, serous layer on the outside with connective tissue covering. Vaginal orifice, nice to know. Now, the vaginal wall, again, has an outer fibrous layer for protection, middle muscular layer, but the really neat, the really neat thing about the inner mucosal layer is it has a lot of mucosa. And again, goblet cells, stratified squamous, and it has also stratified squamous epithelial for protection. Because remember, the vaginal canal is kind of semi-open. So we have nice little roofing, nice little shield, remember? And we also have, there's mucus there for, of course, lubrication. Labia minora, of course, the outer and inner folds. The majora is the outer folds, right? The clitoris. Now, remember, I told you that we both started as the same kind of person, neither male nor female. Well, the glans penis is the most sensitive part of the sex organ, the head of the penis. Well, the most sensitive, of course, which is it corresponds to the male penis and the female, which also has erectile tissue, right, is the clitoris. Okay. Now, vestibular glands. Remember I mentioned the mucus a minute ago? They secrete mucus. Nice to know. Not nice to know. Good to know. Very good. Good question. Clitoris. Very good question. Labia majora minora as a physical barrier. Right? Must know. Nice page here. A lot of questions. Okay, you could see here, and this is good because you need to know what this looks like. Because when we have to start putting tubes and things in places, you know, you read through orifice. This is where I'm going to put the catheter if my urinary cath, right? I put it in there. Of course, the speculum for obstetrics, I'm going to, of course, put it here. This is your vaginal orifice. You have your labia minora, which is the minor fold, labia majora, which is your major fold, and your mons pubis here, which is what men don't have. It's like this little fat pad right here, and which kind of extends here to the labia majora. Okay, and of course the clitoris, erectile tissue, which is, it's a homologue. They're called homologues. It's like, it's a thing, it's the same thing. So the erectile tissue in male would be, of course, penis and culminating in the glans penis, and the clitoris is the homologue to the male penis. Just like the homologue to male testes is the female ovaries. Okay. And the only difference is female had XX chromosome and then has estrogen and progesterone enhanced. And of course, your male patient has XY chromosome and they will have testosterone enhanced. Erection, lubrication, we already talked about lubrication, oops. Right, and again, it mirrors and requires the same thing. Remember, erection, lubrication requires parasympathetic nervous system, but the orgasm requires sympathetic nervous system. I can't stress that enough. And since I stressed it multiple times, what do you think is going to come out? Meiosis 1, meiosis 2, right? We already mentioned, right? This is right? So, do I want to talk about that? No, I don't. Now, follicle maturation, and that's why you have your menstrual cycle and your menstrual period. Right? The primordial follicle is what? The prime, meaning what? The primary follicle. It's the thing that starts, right? It gets enlarged and then becomes mature, and then has this thing called the zona pellucida, which is a glycoprotein layer, and that's what's going to stop whoever didn't make it to the ovum on time. So remember, it's a race for all the sperm to get to the egg. The second the first sperm gets through, typically the zona pellucida forms, and then this glycoprotein layer blocks all the other sperm from coming in. Because remember, mommy has 23 chromosomes. What else does she need to make baby? Just another 23 chromosomes. We don't need any extras. Here is, look, starts at the primordial follicle all throughout your menstrual cycle. And then of course, on day 14 of your menstrual cycle, there's ovulation, release of the primordial follicle, and then you have all the leftover tissue called your corpus luteum, right? And then it turns into your corpus albicans, and then it gets digested and recycled for the next cycle. See here, this is what your mature Graafian follicle looks like, and then right at ovulation, it'll release this egg, the mature egg. Now, what triggers ovulation? We already talked about that, LH and FSH, luteinizing hormone and follicle stimulating hormone. And now you know why they call it follicle stimulating hormone. And now you also know why they call it luteinizing hormone. Because remember, after the primary follicle gets ejected, what is it now? What's the rest of the cells called? It's called your corpus luteum, or luteum, potato. So think what? Estrogen and progesterone, think part of your menstrual cycle. Androgens, think male, okay? Estrogen and progesterone, typically think female, right? But of course, everyone has a little bit of everything, so a little bit of androgens, but the majority is estrogen and progesterone. FSH and LH surge right before ovulation. So menarche, the first time you've ever had menses or your monthly bleeding. In Latin, mens means month, right? So they typically look at it in like a 28 to 30-day cycle. But again, every person is different. Every time is different. And your cycle can be affected by rigorous exercise and stress. It's different for everybody. But menarche is the first one. And of course, menopause is when your cycle stops. Let's look at this picture. Let's pause. Let me yawn. I wish it was for no reason, but I'm kind of sleepy. So let's look at this. We already know that we're going to be looking at like a 28-day cycle, okay? And that's the classic menstrual cycle. So again, it's different in all women, but for our purposes, for studying purposes, we look at a 28-day cycle. So what happens? Midway around day 14, you're going to have an LH and FSH surge. See the LH here? It's going to go bump. I mean, the LH is going to go bump, and the blue is FSH. luteinizing hormone, and follicle stimulating hormone. When they peak around day 13, it signals ovulation, and you'll also have a 1 to 1.5 degree bump in your basal body temperature. That's happens, and that's ovulation. Now, what happens regarding estrogen and progesterone? Well, during the first part of the cycle, the first 14 days, I want you to think estrogen. During the last 14 days, progesterone. Menstrual cycle, the first couple of days, about 5, is called your menstrual cycle. That's when the uterine lining sloughs off, opens up all these arteries and veins, and that's why you bleed. Right? And then once the bleeding stops, you have the proliferative phase, meaning it starts growing and growing and growing and growing until it gets to the second half, which is the secretory phase. Now, if there's no baby, progesterone will drop off, and then what will happen? The menstrual phase will what? Continue again day 1 right after day 28. So the bleeding, the endometrial lining will start sloughing off, and then you'll have bleeding once again. But what happens in the secretory phase when, what do you call that? You have a fertilized egg that met sperm, and now it's in here. Well, you want this to be what? Nice and full of all these tortuous blood veins, veins and arteries, these blood vessels. So what's it going to do? Progesterone will keep on going. It won't drop. And if progesterone keeps on going, there's no drop in progesterone, there's no signal for menstrual cycle. So then it'll go do what? It will maintain this for the next how many months until baby grows. Okay. So you have FSH LH surge, ovulation day 14. Everything before day 14, follicular phase. Everything day after 14, luteal phase. Before day 14, increase of estrogens. After day 14, increase of progesterones. First couple of days, first 5 days, menstrual cycle. 5 to 14, proliferative phase. Then it goes to the secretory phase. And then if no baby, right, no fertilization, it goes back to the menstrual phase. Hence the term menstrual cycle. And this is a beautiful picture with so many questions. I could ask you, when is there an FSH LH surge? You'll tell me, day 13. After the FSH LH surge, what does it signal? Ovulation, day 14. When's the follicular phase? Day 1 to 14. When's the luteal phase? Day 14 to 28. When's the menstrual phase? Day 1 through 5. Proliferative phase, day 6 to 13. Secretory phase, day 14 to 28. When does estrogen predominate? Day 1 through 14. When does progesterone dominate? The green here, day 14 onward to 28. Yeah, that I already did the questions already. Now, menopause, also known as climacteric. That's when you stop the cycle, and it's a phase. It's done in phases. Like, you know, it won't be like one day. Like one day automatically nothing happens, and it happens anywhere from your 40s or 50s. The ovaries no longer produce as much estrogen and progesterone because, you know, we know that in the hormonal cycle things start, you know, cycling down, and of course in that 1 year, slowly they'll have variable changes in their menstrual cycle, a lot of irregularities, and then after, what happens? Since there's no more estrogen and progesterone, there might even be some reversal of some of the secondary sexual characteristics. Another thing that also occurs with it is increase of loss of bone matrix, which also contributes to osteoporosis. And hot flashes, because remember, all the hormones are all now upside down or being turned off. So you're going to have a variable bunch of random symptoms, and it is a trying time. Mammary glands, what's important about them? They make milk, right? Following pregnancy, because of course I want to feed my baby, right? The nipple is surrounded by a sensitive pigmented skin area called your areola. And it makes sense that it's pigmented so baby can see. It makes sense that it's the nipple is very sensitive because so that it can sense baby's lips for feeding, right? The mammary glands are composed of lactiferous ducts, right? And glands to make what? Milk. And we already talked about prolactin and the promotion of the milk letdown reflex. Breasts also come into development. They start during puberty, and they're called Tanner stages. Okay, and you can see here, again, it looks kind of like a funnel, and it's funneling down here for baby. And you could see the areola, it's pigmented, and the nipple is also quite sensitive and has a lot of nervous tissue there. And you could see here, look at all this adipose tissue. Of course, I'm going to need that energy stores so that I can make milk in these mammary glands, and then it's going to get delivered through these lactiferous ducts. And remember, what's really, really important with this milk, and the first milk is called colostrum. What's really important with this milk are the antibodies. We can simulate anything else, in store-bought milk for babies. But the one thing we cannot simulate is mommy's antibodies. Contraception, of course, and birth control, you guys. Coitus interruptus, that's what, pulling out. But rhythm method, you try to avoid sexual intercourse. I don't like 2 days before. I like 2 days before, 2 days after. But the thing is, like everyone's menstrual cycle is different. So this is a little scary. Mechanical barriers, of course, you can have male and female condoms and foams and spermicides and whatnot. But remember, the number one thing is what? Just don't touch each other, right? As a father of multiple children, just don't touch each other. That's the best bet. Nice to know. Again, you learn more about this. Now, getting your tubes tied or tubal ligation. You can see here the vasectomy here is here, but the tubal ligation, what tube do we tie? Or when you get your tubes tied or ligated, right? A ligand is what? You cut them. And that is your fallopian tube right here. Again, STDs, sexually transmitted diseases, sexually transmitted infections, PID, pelvic inflammatory disease, HIV/AIDS, not part of the scope of what we do. And that is it. I hope you guys are having a wonderful vacation, but I made this in advance because I know maybe some of you guys have some time, and while you're looking at before you look at the fireworks and eat your hot dogs and whatnot, you can have this. All right, guys, see you when I see you.